Hi guys, welcome back to the Almost Doctor YouTube channel. Today we are going to be delving deeper into the motivations of medicine station, specifically the question, why medicine? This question can be also phrased in different ways. For example, why do you want to be a doctor? So it's important that you're prepared for an answer. However, whilst this used to be a very common question before, ever since the change in format for the personal statement, with the first question directly asking you why you have applied for this specific course, this question is being asked much less in interviews. But, as always, there is no harm in being prepared. So, whilst this video is specifically targeted for interviews, do feel free to utilise the structures and extra tips when working on your personal statement, as they both may involve answering this question. In this video, we'll break down what interviewers are really looking for when answering this question, how you can structure a strong response, and you can listen to an example answer to observe how the structure has been applied. So, let's get started. So, let's talk about why interviewers ask the question, why medicine, in medical school interviews. Firstly, interviewers are looking for genuine motivation and interest. Medicine is a long, demanding career, and medical schools want to be confident that your motivation goes beyond surface-level reasons. When applying to medical school, you aren't the only one investing in your future, but medical schools are also investing in you. Training a doctor requires a huge amount of time, resources, and funding from the government as well, besides the university fees you pay, to help you transition from undergraduate education through to postgraduate training. Because of this, medical schools want to be confident that the candidates they select are genuinely committed to medicine and are likely to remain in the profession long term. Therefore, they are looking for candidates who have a real, personal and sustained interest in medicine, rather than those who are applying because of pressure from their parents or cliched answers, such as a vague desire to help people, as this doesn't show genuine passion or commitment to the career. Secondly, they want to assess your understanding of the realities of medicine. This question helps interviewers see whether you have a realistic picture of what being a doctor actually involves, including the challenges, pressures, and responsibilities of the role. Strong answers acknowledge both the rewards and the difficulties of a career in medicine, showing that you won't be discouraged from the course midway as you weren't aware of the challenges involved before. Finally, interviewers are looking for experiences that show you're committed to learning more about medicine. This includes work experience, volunteering, shadowing, reading, or wider engagement with healthcare. More importantly, they want to see your reflection, what you learn from these experiences, and how they confirm that medicine is the right career for you. Overall, why medicine allows interviewers to assess your motivation, insight, and commitment. A strong answer shows that you've thought carefully about your decision, explored the profession properly, and are prepared for the realities of medical training and practice. So, how to structure your answer? Any genuine interest starts from a specific point and eventually develops over time, so it's important that you show this journey in your answer. The best way to structure your response is by starting with your initial motivation, then showing how your interest developed through relevant experiences, and finally ending with a reflective summary that links everything together. Let's go into this in a bit more detail. Firstly, personal motivation. This is the starting point of your journey and should address what initially sparked your interest in medicine. This doesn't need to be a dramatic or emotional story, as interviewers are looking for authenticity, not exaggeration. It could be something simple but genuine, such as watching a documentary, reading a book, or having a question about a specific topic that led you to explore medicine further. The key here is to briefly explain what sparked your interest and why it stood out to you, without going into too much detail at this stage. Next, insights and experiences. This is where you show how your initial interest developed into a well-informed decision. You can talk about how your interest led you to do work experience, volunteering, or wider reading. What's most important is not just what you did, but also what you learned from it. Identify the skills you observed in healthcare professionals, such as communication, teamwork, and empathy, and show or provide examples of how you've tried to develop these qualities yourself. Finally, future aspirations and reflection. End your answer by reflecting on how these experiences confirm that medicine is right for you, and briefly mention what you're excited to learn about, or how you hope to contribute as a future doctor. This helps show that your motivation is ongoing and forward-looking rather than based on a single experience. Using this structure shows interviewers your motivation, your initiative for organizing experiences to learn more about the career, how you've developed the relevant skill set yourself, and finally ends on a positive note of your future aspirations, highlighting that your decision to do medicine was well thought out and not made abruptly. Here are a few additional tips that can really strengthen your why medicine answer in medical school interviews. Firstly, provide a clear structure for your answer. A well-structured response is much easier for interviewers to follow and shows that you've thought carefully about your motivation. Aim for a clear structure with a logical flow from motivation to experience to reflection, rather than a list of disconnected points. Secondly, demonstrate how your interest has increased over time through relevant experiences. Interviewers want to see progression, so show how your initial interest developed further through work experience, volunteering, and wider reading, rather than making it sound like an impulsive, sudden decision. And reflect on how or why this motivated you to further pursue medicine. Next, mention qualities you have that align with medicine. This could include communication, empathy, teamwork, resilience, or problem solving. More importantly, link these qualities to real experiences, rather than just listing them, and show how they relate to being a doctor. It's also important to acknowledge the demands and realities of medicine. Strong answers are realistic. Recognize that medicine can be stressful and demanding, and has its challenges, such as long shifts or emotional burnout, but also explain how you're prepared to face these challenges, and why you still feel motivated and prepared to pursue this career. Finally, summarize your answer. End with a brief concluding statement that ties everything together and reinforces your commitment to medicine. Additionally, try to end on a note of aspiration, showing how you want to make an impact as a doctor in the future. This leaves a clear and confident final impression. So now that we have talked about why interviewers ask this question and how to structure a response, let's look at an example answer. As you go through this example, pay attention to how the answer shows a clear journey, linking experiences to skills, and acknowledges the realities of medicine. Think about how you could adapt this structure to your own experiences and motivations. Let's take a look at the example. Here is an example answer to the question, why medicine? My initial interest in medicine began when watching a documentary on human anatomy. Listening to experts talk about the intricacies of cells and the complex networks of tissues and organs within the human body that could not only carry out bodily functions but could also self-repair was something that fascinated me. To explore this interest further, I sought out work experience in healthcare, particularly the surgical department of a hospital. Being given the opportunity to watch surgical procedures, I was not only fascinated by the technical precision involved, but also the teamwork, calm decision-making under pressure, and trust between the surgical team. Observing how surgeons combine scientific knowledge with practical skills to have a direct impact on improving a patient's quality of life, and witnessing the fulfillment of patient recovery, motivated me to pursue a career particularly in medicine. Through this experience, I observed healthcare professionals demonstrate strong communication, teamwork, and resilience, particularly when dealing with anxious or unwell patients. Wanting to develop these skills myself, I took on a part-time role as a tutor, which taught me patience, responsibility, and how to communicate effectively with people from diverse backgrounds, especially those with cognitive or physical limitations. Speaking to doctors also informed me of the challenges of a career in medicine, such as working long shifts during unsociable hours. However, hearing about these realities did not deter me. Instead, it helped me appreciate the level of commitment required and confirmed the importance of maintaining an organized work-life balance. These experiences confirmed that I want to pursue medicine as a career. The lifelong learning of science and using that knowledge to restore people from a vulnerable state is something that I really want to do in the future, and I'm excited by the opportunity to deepen my understanding of the mechanisms within the human body, solidifying my ambition to pursue medicine. This example is a strong and well-motivated answer that clearly demonstrates genuine interest in medicine, relevant exposure, and reflection on the skills learned. The motivation is authentic and is supported by experience, which is exactly what interviewers are looking for. This example begins with genuine motivation, naturally using a documentary as a starting point, which feels realistic and authentic rather than forced. This interest is then built upon effectively by the use of work experience, by showing how shadowing surgeons built upon the initial interest mentioned in the answer. This answer also reflects on teamwork, decision-making under pressure, and patient impact that they observed during the work experience, which are key medical attributes. This answer also shows how this person moved beyond observation to personal development, showing how they are taking initiative to develop these skills and attributes within themselves. This answer also shows that the person has a realistic understanding of medicine by acknowledging some of the challenges involved, which shows maturity and shows that you are not deterred by the challenges, which is exactly what interviewers want to hear. Finally, the answer ends on a positive note on what the person wants to learn more about medicine in the future, showing genuine interest and commitment. Admittedly, this answer does repeat phrases quite a few times, and the sentences are quite long, so when saying your answer, do make sure to take breaks in between. However, remember that it is perfectly natural and normal to repeat yourself sometimes. Just make sure it isn't done too often. So, that's it for today, guys. Remember to take some time to reflect on why medicine matters to you, not just what you've done, but what you've learnt, to make sure your answer stands out naturally. Practice structuring your response, stay authentic, and speak with confidence. Good luck, and thank you for watching.